I welcome the motion put forward here today as constructive and timely in terms of the present challenging trajectory of dental service provision in Ireland. Dental Services Minister is a subject that comes up repeatedly in constituency offices all around the country. This is no surprise given the increasing population we have versus the declining investment in state-supported expenditure to dental schemes and dental care. And the headline statistics show that the service is actually in crisis. 104,000 children on a waiting list for school screening dental services out of a pool of over 200,000 students who can avail of that. The number of medical card patients seen under the Dental Treatment Service Scheme has declined 35% in 10 years, as a horrid statistic. And yet, at the same time, the number of dentists participating in the dental scheme has reduced by almost 50%, down to 810 in the past 10 years. And I think that number is even down to 600 of those who are actually practising in that minister. And as each year goes by, more and more dentists are withdrawing from the DTSS, and this is evidence surely of a scheme that is not fit for purpose. And beyond all of that, we have the issue of the number of dentists that we graduate in this country each year. Just 300 nationally, and of those, over half of are overseas patients. That brings me to another interesting point, Minister, which is the issue of the South East Technological University. And dentistry is one of the programmes that has been bandied about as been possible for SETU. And what is at play here is a lack of any will of government to invest in providing increased dentistry services. Among the main calls within the motion today are to ensure that all primary school children will receive their 3 school-based appointments at their appropriate age by 2027. That doesn't appear to me, Minister, to be an objective that should be too difficult if the will was there to receive it. We used to be able to do this. Also, to review the funding to expand the capacity of public dental services for children and special care patients, as well as to resource the medical card scheme properly. And that is at the bones of what the problem that this motion is seeking to address, Minister, is the support to the medical card patients, who those outside medical cards who do not have them, having to try and access private dental services. The motion also calls for the publication of a new dentist bill by September 2024 this year, and within it to address the capacity issues in dental education and prioritise comprehensive workforce planning. In other words, Minister, publish legislation that is going to put out the roadmap to finally solve our problems of dental service in this country. But all of this assumes the government has a comprehensive plan and that individual initiatives within the plan can address the limited access to services in a timely manner. As you know, medical card holders are supposed to be able to access the DTSS, and any local representative here, and many here have already told you today, Minister, there is ample evidence that that is not happening. The treatment benefit scheme, another scheme within the service, is supposed to provide dental care for non-medical card holders if they have sufficient PRSI contributions. But anecdotal evidence, Minister, would suggest to you that dentists have avoided providing services under this scheme also because of the long delays in getting reimbursed for their costs and their work. The public dental service is also failing in its remit to provide early oral health assessment for primary school children and the primary care treatments that arise from this. And many of us are aware of parents whose children have gone into secondary school, in fact, without being properly attended to under this scheme. And indeed, it has already been said that many families are suffering significant additional costs in trying to access private care when they are already struggling with the cost of living crisis. The situation for children also with significant orthodontic requirements is even worse, given the lack of access to qualified people to take on this work and the significant waiting lists. And Minister, again, as an elected representative, I am constantly approached by people in this situation. And it is heartrending to see people who are waiting years for children to have, what are basic treatments to be done in terms of orthodontics to try and access that service. Minister, overall, the summary is the present strategy is not working. The 2019 National Oral Health Policy Smile August launch seeking to provide better care access at all levels, but with a particular focus on reorientating the provision of public dental service for children away from the public dental clinics and towards the private dental sector, But if we're going to do it, Minister, can we not get on with it? You know, if we recognise that in the private sector maybe it is possible to get better value for money, but then get about engaging with the dentist reps and reimbursing them properly for their services. That policy would see treatments carried out by private dentists contracted by the HSE. But the reason the policy is failing to get traction, it has been the habitual failure of government to understand the costs in running a business, which that's what a private dentist business is. It is a business, and dealing with the bureaucracy and the delays of public procurement and reimbursement. That is where the logjam is, Minister. And there has been, as I say, a history and a lack of real engagement by government with national dentistry representatives. So we have a capacity and a funding issue with respect to national dentistry and orthodontic provision. We have to make steps to address both, and it is the job of government to ensure these two objectives can be met while delivering value to the taxpayer and service to the citizen. You need to publish your heads of the new Dental Bill, Minister, and show how you plan to address the continuing dysfunctional performance of our public health dental and orthodontic services and the steps you propose to address these.